Hi guys. Mary, say hi to the vlog.
Hi. Hi guys, how have you been? Guys, we've missed you. As we said from our previous video, we are back and back and back.
With a bang.
Coco.
So guys, please subscribe to our channel, share and comment our videos, and yeah, take us to the next level, guys.
Guys, we trust you. Wherever you are watching us from, we trust you.
We don't take it for granted. Leave this girl. Don't take it for granted.
If you're on the
Thank
channel
you.
watching and you have not subscribed,
Hey,
kindly
please subscribe.
subscribe.
Yeah, so today,
Watch till the end without
Yeah.
skipping any ads.
don't skip the advert.
Yes.
Yeah. Today we are in a new place. We are shooting from a different area. Have you noted? Yeah, but yeah. So today we are doing what, Mary?
Today, it's a bit devastating situation for a pregnant mother,
Yeah.
but it is good we know why we get to that devastating point.
Yeah, it's good to know.
Yeah, so and probably we'll also be touching on how we can cater for it.
Yeah.
We are talking about preterm birth.
What causes preterm?
What causes preterm birth?
Yeah, or even labor. Yeah, you see, birth will come after labor. Yeah.
Labor will come after birth.
Birth will come after labor. You labor first and then you give birth.
Yes.
Okay?
Yeah. So,
Yes. So
preterm birth.
So what what is preterm labor or preterm birth?
Preterm birth is, or preterm labor,
Yeah.
is any labor or any delivery that comes before that 7 weeks of gestation.
Yeah.
And this one is divided into 4 sections.
Yeah, divided into 4.
4. The first one, we say there are babies who are born before 25 weeks.
Yeah.
They are called extreme preterm birth.
Yeah.
There is another one that is born between
25
to 32.
and 32 weeks. What do we call that? A very preterm.
Very preterm.
Yeah.
There is another one, moderate preterm, that is between 32 to 34.
Yes.
Moderate preterm.
Yeah.
And there is another one, late preterm, from 34 to 37.
Yeah.
All this defines the viability of the pregnancy. The higher we are in gestation, the more likelihood of viability of the pregnancy.
Yeah, exactly.
Yeah, when you get a prem baby, it's
Yeah.
usually a very...
It's a devastating moment.
Yeah, for
because
the
you are
mother.
hoping for a term baby.
Sure.
But due to some
Unavoidable circumstances.
You find that the baby is born preterm.
Sure.
I think even as a mother and as a health practitioner, if it was their will for them to carry that baby to term without the preterm birth, then they would do anything to save that delivery. Yeah. But sometimes when you see things happening like that,
we say they happen for good.
They happen for
and now
good.
From there we pick up our paddles and we move on. Yeah. Now, what are the major causes or the risk factor? Because it's said that the major cause is not really known.
It's still not known.
It's still not known. It's idiopathic.
Yeah.
But we associate it with several. There are things that can happen to a mother who is pregnant.
Yeah.
And there are risk factors rather.
Exactly.
Yes, that would aggravate.
Exactly. Mary, it's also good to mention that the earlier the baby is born preterm, the more the complication. It's also good to mention that a preterm baby will not grow as normal as a term baby. Normal, I mean that this baby is subjected to so many complications depending on the age. For example, a moderately preterm baby will not present the same way as an extreme preterm. So an extreme preterm will be will be subjected to more complications than the moderate preterm. That is what I meant. And then the complications mostly are based on the respiration, that is the breathing,
respiration distress,
and the feeding. Okay. So maybe you can tackle a bit on the respiratory. These are
respiratory distress. Yes. Yeah. Okay. What happens?
Yeah.
Baby by gestation, by second trimester, we are already in second trimester after 24 weeks. This is a baby who is fully formed.
Yeah.
But the only organ that remains is the lungs.
Yeah.
So they are poorly formed before 37 weeks of gestation.
Exactly.
So when the baby is born, yes, he has all the structures, all the hands, the legs.
The body is physically formed.
Yes.
The physique is okay.
Actually, even when you talk to most mothers, their psychology in second trimester is they just shift from am I pregnant to is my baby fully formed? Because this is where in second trimester, this is where the mother starts thinking, has my baby have all the structures as required?
Exactly.
The only organ that is never fully mature is the organ until the lungs until 37 weeks. Sorry.
Thank you. Yeah. So breathing is it's a vital thing. And if the respiration is not fully functional, then the baby has to be put on support because of that gestation. Another thing, this baby has to feed. This baby has to survive on food. Remember, this is a preterm. We can't feed this baby on milk. We cannot.
They cannot like breastfeed direct.
Yes, yeah. So that is why we find them with a tube. Yeah.
I think one of this. So what was I saying, guys? I was saying respiratory distress.
Yeah, you were talking about feeding, the tube.
Oh, yeah.
Yeah, we had done the respiratory. Now we are talking about the tube. We find that the baby has to be fed. That is why sometimes when the mother is given a permission to express for the baby who is preterm in the incubator, then they normally do that. But for the extreme preterm,
they feed either through via the cannula. They are given some glucose.
Yes.
Or they have the NG tube.
Yeah. So that is what we wanted to mention. So now we go straight to the what
are the risk factors? Or what are the things that would attribute you having a planned delivery?
Exactly.
We start with one, age of the mother.
Age
of the mother. Age of the mother, what does it mean? If the mother is below 20 years.
Yeah, below 20 years.
Below, under 20 years. This means an extreme young mother.
Yeah.
She's at risk. We didn't say she's going, but she's at risk of having a preterm birth.
So all what you are mentioning is not, it is just at risk of. You are at risk of having a preterm.
Because her hormones probably are not well formed.
Exactly.
Her body is not very ready.
She's still small.
She's still young.
Yeah.
Some have late menarche.
Yeah.
So probably the hormones that support pregnancy, progesterone and estrogen,
they are not balanced.
Probably they are not well balanced.
Yeah.
Another one is extreme age. Some countries, the elderly after 40 years.
That is after 40.
Not all after 40, but
at risk.
At risk.
Remember, it's at risk.
Is at risk.
Yeah. You can fall in a percentage, in some percentage.
Hormonal balance also. This is a mother who is approaching menopause.
Yeah.
Depending with at what age.
Yeah.
Or depending with your race.
Yeah, remember nowadays menopause can even come in early.
Yeah.
They can come in early. So it is, when you talk about old, after 40,
it doesn't mean that you're not just saying that you're so old.
Yeah.
But some people, their hormones just start misbehaving after 40. So guys, when you are in that gestation, when you're in that age blanket, under 20, above 40, it's always advisable. See the doctor the soonest you know.
Immediately you conceive.
You conceive that you notice that you're pregnant.
Yeah.
Yes.
So we've talked about age, extremely young and elderly. So another thing is stressful life events. Like, okay, I would talk about like a stressful environment. Maybe loss of a loved one.
Sure.
Loss of a job, sickness, situations like that can make, even they found you when you're pregnant, they can pause you into, even transfer to a different area where you need to settle. Or even just some stress. You know, everybody has a threshold for stress. You never know what you can handle. Yeah, so yeah, stressful events or stressful environment can pose you to preterm. Or even domestic violence, those things, fights, those things can pose you into that. What about carrying of multiple pregnancies?
Yeah, okay, let me take you back to the stressful event. What would cause you have miscarriage? It's just by you having so much of hormonal imbalance due to raise of adrenaline. Anytime you are handling these events, you produce a lot of adrenaline that inhibits the production of the pregnancy support hormones.
Can we also add stress, work stress?
Yeah.
Work stress for somebody who really needs to put a lot of effort, and you are pregnant, you're supposed to be working early, you're supposed to leave late. So work stress can also pose you to that. What else?
Yeah. So I think the third one should be carrying more than
one baby. Yeah.
It can be twins, triplets, quadruplets, or 5. We've seen in the media. It's a blessing, yes. So what happens? Your tummy gets extended.
It's
overstretched.
Yeah.
To the threshold that maybe by the time you look like a cigoton. A cigoton, when one baby is at 40 weeks.
Yeah.
This one you will be probably, let's say you have twins.
Yeah.
And at 30 weeks.
At 20.
You look like somebody with a cigoton at 40. So your body can set those signals like we are full term.
Yeah.
And then eventually you go into labor.
Yeah, so that is well explained. So another thing is maybe the problem with the uterus and the cervix. This one I can explain in, you see, somebody with issues of the uterus, maybe with fibroids. A fibroid is a growth that occupies the uterus. And now there is a pregnancy growing inside the same uterus. So you see they are fighting for space. And some mothers get very big fibroids. And you see most fibroids grow very, very much with the pregnancy. So the way the baby is growing is the same way the uterus, the fibroid will grow. So we find that a uterus with a fibroid can make you have a preterm baby because of simply the space. And then for the cervix, some mothers have the cervix which is maybe incompetent. At a certain gestation, it will reach a point whereby the cervix will not support the weight of that pregnancy. And so it will open on its own and the mother goes into spontaneous labor. Yeah, so that will cause the preterm labor.
And also, for the cervix, there are those mothers who basically have short cervix.
Yeah.
And as it shortens, it's like effacement start dilating.
Yeah.
And also the mothers with the vaginosis that's the disease that affects the cervix.
The infections of the cervix. Yeah.
Yeah, it may ascend and then you spontaneously also go into labor.
Preterm labor. So another thing is maybe chronic health issues of the mother. For example, high blood pressure, diabetes. What else, Mary? And any other thing that can maybe make the mother get imposed to that.
Or clotting disorders.
Or even clotting disorders. Remember, like we discussed with in our previous video, we went much deeper into hypertension, into preeclampsia.
Eclampsia right now, I think because of the life standard and life expectation. I don't know, I don't know in your country, in your where you work or where you live. Have you seen like
it is really increasing.
It is really increasing.
The numbers are very high nowadays. Yeah, we really need to know how to curb with the numbers which are going up.
Because it is really going up with a very high rate. And then when it starts, it's so acute.
Imagine. It starts all of a sudden. Somebody was not having it and then it starts all of a sudden. Then another thing is the diabetes. Diabetes is the high sugars in pregnancy. Remember, these high sugars will make the baby grow so big. Like you will realize that a baby growing like in 20 weeks, if for somebody who has diabetes which is not very well controlled, the weight of the baby will increase and you'll find that it has overstretched the uterus. And you see, we have already talked about overstretching of the uterus
and body signals like your term.
So you end up going into labor prematurely. Yeah, so next, Mary, we have talked about infections.
Infections, like urinary tract infection, that is one of a major cause. We do so much of self-medication at home. With urinary tract infection, you start getting that frequency of micturition, of urination, painful micturition.
Exactly.
And what else? Which fevers?
Yeah, you feel even, apart from painful micturition, frequency, fevers, pain,
abdominal pain. Most people try to do self-medication at home. Please, when you're pregnant, let us avoid
self-medication.
So, yes, because something small like UTI can cost your pregnancy.
Can cost your pregnancy.
So please, mothers, avoid self-medication.
And even apart from the UTI, the sexually transmitted diseases, those ones are known to cause maybe the preterm labor because most of them are measured on the reproductive organs. And then we had talked about hepatitis. Okay. Yeah, so next we go to smoking and alcohol. Okay, for mothers who smoke, I would say they are posing themselves to a risk of preterm labor. Why, Mary? Like for cigarettes, we have that chemical.
For cigarette, we have nicotine. What happens? Once you take some of those, like that nicotine, it goes and stacks on the bed of the placenta at this site. And your placenta starts expiring. Even before term. You get those infarcts, and now the baby becomes small.
When you want to know about infarcts, refer to our previous video. We have talked about infarcts from the placenta, the silverish patches.
So the baby doesn't get enough food in the utero, so the baby doesn't do what? Doesn't grow. So you end up having a small foldate baby. And the only solution is either to terminate the pregnancy regardless
because the baby is not happy
inside the uterus. So guys, if you are smoking and you are pregnant, kindly talk to your care provider so that she or he can connect
and can advise.
Can connect you with the counselors and people who can help you stop using drugs, alcohol, and cigarette smoking.
Exactly. Then there is another point that is, I know it will bring a lot of controversy, the genetics. Yes, preterm labor can reoccur in families. I've had clients who have told me, somebody comes in labor and she tells me, my mother delivered me at 32 weeks. Then the mother tells me her mother delivered her at 30 weeks. So it can run in families and it can be hereditary. Mary?
Sure. And with that, those are just risk factors on preterm birth. There are many more.
We've just tackled
the major ones.
The major few, yeah.
The major few.
Yeah.
If we can be able to prevent
the
preterm
labor.
Guys, having a preterm birth, choose the mothers or the parents or the society allowed that mother. Their psychological feelings, emotional.
Yeah.
It's not costs. It's very expensive.
It's a very expensive
affair.
Yeah.
If it's a problem that we can avoid,
yeah,
guys, let's always attend to our antenatal clinic.
Yeah. Follow what you're told by
follow
your
what you're told.
Yeah.
If you feel you're not comfortable, there is no harm in seeking second opinion.
Exactly.
And just have your heart
at peace.
Exactly. If it's your curse, well, we've
receive
it. We've done our best.
Yeah.
Let's take care of that baby.
Yeah.
I think on our next video, we'll talk about the complications.
Yes, the complications of
related to having a preterm
baby.
Yes.
Yeah.
So guys, kwaheri.
Let's
subscribe, share. We are still on Midwife Reality Show.
Yeah, bringing you the best.
Yes.
Okay.
If there's anything you want to comment, anything you would wish us to do for you, faithfully, we are here for you guys.
Yeah. See you in the next one. Bye-bye.